ceremony for the community health volunteers from Nairobi Metropolitan Service.
Iliamua kushirikiana na wakfu wa utafiti wa matibabu barani Afrika na COVID-19.
All our community health worker needs is to all of you who are graduating today.
Ishike mpaka kwa mapua. Tunasema proper mask wear.
Confirmed the first coronavirus case.
Your families and the community. I thank all. It also goes to the Nairobi Metropolitan Services and all other partners and the rest of the world. I encourage you all to remain faithful to this special calling as health advocates. We have learned that more effort will be required from all of us to eliminate the risks that make us.
We have Asha Matingi Hassan. Hongera sana Asha. We are very proud of you. We do have Mary Gwoneki Najoli, and a mother of two. Hongera sana. Patrick Malachi from Mashimoni, Langata Sub-County. He has also been a CHV for a decade. Francis Oma Odera, who has been a CHV also for the last 10 years and a father of 8 children. We next have Henry Wagude Ouma from Kamukunji, who has been a community health volunteer for the past 3 years and a father of 3. We thank you for the wonderful work that you continue to do at the community level. We have Michael Kimani Mungai from Kabiria, Dagoretti Sub-County. He has been a CHV for the past 4 years. Hongera sana. We have Elizabeth Njeri Nyaki from Westlands, who has been a CHV for the past 5 years. Thank you so much for the wonderful work you continue to do. We have Anastasia Mbala Mwaoka from Ruaraka. She has been a CHV for the past 16 years. Hongera sana for the wonderful work that you continue to do and for the communities that you continue to serve. We have Jacob Kenyatta Miti, who's from Kasarani, a CHV for the past 15 years. How wonderful. Thank you for the wonderful work that you continue to do. We have Helen Anyango Mbata. Congratulations. She's from Raraka and has been a CHV for the past 28 years. And a mother of 5 wonderful children. Thank you so much, Helen.
Today, we converge here to celebrate community health volunteers. They are graduating under a partnership with Beyond Zero and the National Metropolitan Services. Amref Health Africa is immensely grateful for the partnership we have had with Beyond Zero in the last couple of years. Through this partnership, we have worked together to improve the health of the people of Kenya, from freeing women from bondage of obstetric fistula, ensuring children get immunization at the Beyond Zero mobile clinics, to now fighting COVID-19 pandemic. Your Excellency, your passion for the health and well-being of Kenyans is an inspiration to all of us. We know that together, in solidarity, we will overcome the COVID-19 pandemic. In our current partnership, the Office of the First Lady, through Beyond Zero, granted Amref $42,000 to train 5,100 community health volunteers to be agents of change in the fight against COVID-19 in the whole of Nairobi. using the training curriculum developed by the Ministry of Health, AMREF using LEAP to train community health workers. The LEAP is an incredible mobile platform for training CHVs. The platform enables community health volunteers to learn anytime, wherever they are, without having to converge in a workshop, because doing so would put them at risk. Today, we are delighted to announce that we have trained over 5,000 community health volunteers on 3 key topics. 1, the basics of coronavirus transmission and prevention. 2, social stigma reduction and community engagement. And 3, COVID-19 community disease surveillance. More than 5,000 trained community health workers are now deeply engaged in stopping COVID-19 in Nairobi through behavior change communication, case identification, contact tracing, and referral. They are enabling individuals and families to sustain key prevention behaviors, especially hand hygiene, cough hygiene, physical distance, and wearing masks in public places. Besides, they are supporting continuity of service because mothers who are pregnant need care, children need immunization, and those suffering from disease such as malaria, pneumonia, TB, HIV, diabetes, and hypertension need health care during this pandemic. We don't want a situation where we save people from COVID-19 for them to suffer and die from these other diseases. As we continue fighting the COVID-19 pandemic, let us remember that our frontline health workers are our heroes, our soldiers in this war. COVID-19 is the war of our lifetime. Therefore, we must take care at all times, in all ways, of our community health volunteers. Community health volunteers need various types of PPEs and supplies, including sanitizers, masks, and gloves, to be able to do their work in the community during this pandemic. Indeed, we need to recognize community health volunteers as part of the healthcare system and remunerate them commensurate to their work. I thank Her Excellency, the First Lady of the Republic of Kenya, and the Beyond Zero initiative for providing leadership in the fight against COVID-19 through this timely investment in community health volunteers. I also appreciate the support that the national government is providing to the COVID-19 response, including ensuring coordination of all efforts. Thank you to Nairobi Metropolitan Services for embracing and supporting the work that community health volunteers do. Together, in solidarity, we will overcome the pandemic. Thank you.
On behalf of the Nairobi Metropolitan Services, I want to take this opportunity to say how delighted I personally am to be involved in this graduation of these very able men and women who are really frontline workers, especially where COVID-19 is concerned. Your Excellency, we appreciate this partnership of Beyond Zero and AMREF and ourselves in the Nairobi Metropolitan Services, especially in giving skills to these frontline workers known as community health volunteers, because as we fight this COVID-19 pandemic, they truly are the frontline workers. Nairobi Metropolitan Services has over 7,340 community health volunteers. We are very, very happy to know that 5,100 of them are now trained through this partnership, and we promise that we'll use them even as we work with other partners. We'll make sure that they make use of these very, very ably trained community health volunteers. Nairobi Metropolitan recognizes that there is a shortage of community health assistants who are the immediate supervisors at the community level, and through the UHC program, we'll be adding onto that number so that they also work with proper supervision and linkages with the level 2 facilities within Nairobi, and more so in the informal settlements. Excellency, some of the difficulties the community health volunteers have continued to face are, of course, adequate PPEs to be able to work properly without infecting themselves or their families, and of course, a stipend, which is all-inclusive with all the partners who are working in Nairobi and I believe in other counties as well, so that they are able to take care of their families. This is something through the community strategy the government is addressing. Even as I complete, it's my humble plea that we could train through this partnership or any other partnership the remaining over 2,000 community health volunteers in Nairobi so that all of them are operating with the same skills. NMS will continue looking for partnerships so as to be able to do this. Because beyond the COVID pandemic, these men and women will continue to be very useful, especially in the primary health care services of this country.
Good afternoon. I hope you're keeping well and staying safe. I'm honored to be part of this graduation ceremony. Congratulations to you, the first graduating cohort of community health workers. Your commitment to successfully complete the COVID-19 response curriculum, despite the demands on your time by your family and your work, is truly commendable. It has been 5 months since the first case of COVID-19 was reported in our country. We have witnessed how quickly the pandemic changed our individual lives, those of our families, and the country at large when the first case was discovered in March this year. Many months later, we, like the rest of the world, still do not have all the answers concerning this new disease. Every day we learn more about it, how it spreads, and how it continues to impact us all, our livelihoods, our education, our jobs. But we do know that there are certain things we can all do to stop the spread of COVID-19 in order to protect our families. We know that the simple act of hand washing has always been the guard against transferring germs. We have unequivocal evidence that wearing masks and social distancing also contribute a huge impact in protecting us from the spread of this pandemic. We have learnt that more effort will be required from all of us to eliminate the risks that make us more vulnerable, especially amongst the elderly and those facing other multiple health issues like heart disease, diabetes, and cancer. Community education on health matters can save lives, and it is critical at this time. This is where each one of you plays a critical and important role. Through the COVID-19 curriculum and guide developed by the Ministry of Health, you are now empowered and equipped with knowledge, skills, and competence to protect yourselves, your families, and the community. I thank all of you who signed up to participate in this very important training developed by the Ministry of Health and delivered by AMREF and sponsored by Beyond Zero. I applaud your selfless commitment to your work and your courage and compassion for people and for the community. I acknowledge the sacrifice you give of your time towards the demanding role of being community health workers. I would like to thank the Ministry of Health and its partners for their tireless work in mitigating the severity of this disease and the impact it has had in the country. Thank you, AMREF, for the innovative LEAP mHealth platform that has enabled inclusivity and opportunity for community health workers to participate through mobile phone technology. My thanks also goes to the Nairobi Metropolitan Services and all other partners who have also contributed towards this COVID response initiative. I join the government, the people of Kenya, and the rest of the world in recognizing the bravery of all frontline health workers. You have been at the heart of this COVID-19 pandemic. You have been actively involved in contributing towards national efforts in tackling health issues facing communities. Your work keeps us safe, especially during this pandemic. The support to families and communities has become more urgent than ever. Jobs have been lost, household resources have been stretched beyond belief. Food and good nutrition is essential in keeping mothers, the elderly, children, the entire family healthy. We are all affected, and it will require all of us to support each other in any way we can to ease the disruption this pandemic has caused to our lives. We must also be sensitive and reject stigma and isolation towards individuals and families who have been affected by this pandemic. Instead, let us offer compassion and comfort. I look forward to hearing the news of the successful completion of all 5,100 community health workers and the positive impact you will be making in your respective communities. I encourage you all to remain faithful to this special calling as health advocates. On my part, I will continue to support the work that you do as our frontline health advocates. Once again, congratulations to all of you who are graduating today. I pray for God's protection over you and your families. Asanteni sana, and God bless you all.